Dr. Marina Alois Njelekela. I'm an employee of Deloitte Consulting Limited in Dar es Salaam. I'm the Chief of Party of USAID Boresha Afya program, which is a USAID funded donor project for care and treatment of people with HIV, but also we deal with TB, malaria, family planning, and maternal and child health. Being a medical doctor, really it didn't just come by surprise, but I started having this thought of becoming a medical doctor during my early childhood. And it came out of an experience, which was not a good experience, of my brother who had a penicillin allergy, a very severe form of penicillin allergy, and was admitted at the then Princess Margaret Hospital. That was in early 60s. And he was treated there and was discharged as a normal person, but he was left to live in hospital alone. So I was going there to visit him with my parents. So whenever I go to the hospital to visit him, I saw the nurses who were wearing pink dresses and a white cap. So I came to realize those were student nurses, but the dressing inspired me a lot. So I said I will become a nurse. But as I grew up during my primary education and secondary education, I was very good in science. And at the same time, I came to realize the differences between the two professions, who is a nurse and who is a doctor. And I came to make a decision that I think I will become a doctor. So earlier on in my primary education, I concentrated myself in science, knowing that I have a destination to reach, and that is to become a medical doctor. Likewise, during my secondary education and A-level, I performed very well, and I was selected to join the Muhimbili University, then the University of Dar es Salaam, Faculty of Medicine, and I pursued my medical education and completed my studies as a medical doctor in 1993. So soon after graduation, I pursued my internship at Kilimanjaro Christian Medical Center Hospital in Moshi for 1 year, and I came back to Dar es Salaam and I was employed by the Aga Khan Hospital for 1 year, that is 1994 to 1995. And then in 1995, I decided to go back into public service. And this is because I wanted to pursue my career even further. So I was sent to Kisarawe District Hospital, where I worked for 6 months. And around June 1996, Muhimbili Orthopedic Institute floated work positions for registrars. I applied and I managed to be an employee of Muhimbili Orthopedic Institute from 1996 to 2001. So during my career as an orthopedic registrar, it was a very busy then when we were starting Muhimbili Orthopedic Institute. And then it was mixed by me having a passion to have a baby. Then I thought, if I'm having a baby in this very busy environment, how will I be taking care of my baby during the night? Because I was to stay at calls at night. So that was kind of a shift. I decided to pursue a career as a teacher at the medical university, then the Muhimbili College of Medicine, which was affiliated still to the University of Dar es Salaam. So I started my career as a Muhimbili faculty in 2001, and I continued for about 10 to 11 years. And during the time when I was working with Muhimbili University, my passion for public health started to be initiated inside me. And by 2010, I decided to pursue Masters in Public Health. So it was a 2 years course. And at the same time, around 2011, I noted of an advertisement for Executive Director of Muhimbili National Hospital. So while I was studying MPH, I applied for the position as the Executive Director of Muhimbili National Hospital. I went through the interviews, and I was appointed in November 2011 as Executive Director for Muhimbili National Hospital. And as the first female Executive Director for Muhimbili National Hospital. I worked there for one term, and I decided to go back to Muhimbili University as a lecturer. And in 2012, I graduated as MPH specialist with my Masters of Public Health. And during that time, my passion even grew more towards public health. So I saw an advertisement as well for Deloitte looking for a chief of party, of which I pursued the interview, and I was appointed as the chief of party of USAID, Boresha Afya, which initially the program was Tunajali 2. As a female leader, going through all this trajectory of career, well, you find some barriers. For me, the major barrier which I find I encountered during my route is having the confidence of others who are surrounding you, and especially men, that you can do better or you can manage. So sometimes you feel that I cannot apply for this position because how people will feel, how people will see me in this kind of a career. But the most common as well for us female leaders is the balance between family and work. So you find that you may be inclined more on work and you leave your family, or you may incline more on family and you fail to pursue higher levels in your career. So that balance really needs support. And for me, I'm grateful to my mom, late Benada. She really took care of the family issue for me, especially my daughters, when I was struggling to ascend through the career ladder. For the young generation who are growing up now, I think the first thing for our girl children is to identify what they want to be. It's not easy to just come up and say that I want to become a doctor. At least the passion should start very early in life. It's the responsibility of the parents to at least ask their children, guide them through career trajectory very early in primary education, or even lower to levels like kindergarten. After a child has identified, maybe I want to be this, somebody may have 2, may have even 3, you try to guide them. So after identifying whom you want to be, it's good to be focused, to work on it so that you achieve your dream. It's not bad to dream during early life. You can dream to become a pilot, you can dream to become a doctor, a nurse, and you may find out if the dream continue to repeat, you start working on it, be focused, work hard on it, pursue the type of subjects in primary and secondary education that will lead you to the career you want to be. And when in the career, continue working hard and persevere, and you will definitely attain the highest level in your career, and you'll be proud of what you have done. Thank you.
CV People Africa Initiative.